difficulty which we face during cesarean section is managing a TP engagement. So most of this occurs in the second stage of labor when we have applied forces and it is a failed forces. Then we decide to do cesarean section, and at that time it becomes very difficult because the head is wedged in the deep in the pelvis. So there is no space for us to go inside unless there is some air comes in or some release of this vacuum effect. We are not able to push the deliver the baby because we can't go below the baby and take out the fetal. At that time, what happens is our incision extends laterally and lands up in hematoma and severe bleeding. So for that, we have different methods. One is an assistant pushing the baby's head from below. Another one is a fetal pillow. We don't have the fetal pillow, but we try to demonstrate using our ventouse because it's something like the ventouse with a posterior blade and with a vacuum. So we are using the ventouse and the Foley's balloon to act like a fetal pillow this time. The third one which we will be demonstrating is the Patwardhan's method, and the fourth one is the reverse Breech method for deeply engaged head. So now the head is deeply engaged, and assistant you would request to push the head. How do you push? You hold it like this and flex it and push it up. The whole baby. It should not be a finger. Sometimes we may not be able to hold the baby's head. We may tend to injure the baby. So that is why a fetal pillow will be better, or hold it neatly and try to push it inside. So try to push the head. So when the assistant pushes, we can deliver the head. So the next is the fetal pillow. The pillow. They have the pillow. So this is like a fetal pillow. So this is passed from below like this, and it is this balloon. It is available as fetal pillow. Maximum capacity is 180 ml. At a time you can put 60 and inflate it so that this goes posteriorly, and there is a cup which goes towards the sacrum. It rests on the sacrum, and this balloon pushes the baby's head up. So this way, this is called as the fetal pillow. A fetal pillow is available, it will be wonderful. We can handle deeply engaged head. So this is the second method of delivering a deeply engaged head. And the third method is the Patwardhan's manner. So in the Patwardhan's manner, the baby's head like this, it's deeply engaged, and you are not getting anything out of to hold. So what you can do, suppose the baby's back is like this, behind. We can deliver one hand first, and then one foot, followed by the other foot and the other hand, and then deliver the baby's head. So this is for the back which is posterior in Patwardhan's method. Now the back, if it is anterior in Patwardhan's method, so what we do is the shoulders are already there. Now you flex the trunk like this and deliver the baby like this. And then the last baby is this is for that is the chest is bent and lifted. And the last one is the reverse breech. So for it, you have to find out the foot. Most of the time you may by mistake bring out the hand, but don't get panicky. Push it back. You have to do everything slowly and not become panicky. If you become panicky, then there could be injury to the fetal parts as well. So slowly move to the back. This may be slightly difficult if there is not enough fluid, but still you may be able to do. You go posteriorly, catch hold of the foot and try to bring the foot. So the foot will come to the incision. And one foot comes, the other foot automatically comes. You don't have to search for both the feet. When you put one foot, it comes, and then the baby's breech is blocked, and then the other foot. So this is called as a reverse breech extraction. So this way we can deliver the head. Sometimes what happens is, when the head is deep down, you are trying and you have brought everything, but you are not able to bring down the foot. You are struggling. It is no light. don't hesitate, make the incision big. You can make an inverted T, no problem, because baby and mother are important. So inverted T, when the incision becomes a little bigger, you can do a reverse breech extraction, bring the baby very easily. So that is another thing which we should not hesitate. So when we, sometimes with transverse incision or balancing incision may not be enough. So in difficult situations, especially if jammed below, then we may have to make a T-incision on the abdomen. So that is the way we are going to deliver the T-incision. One is you can assistant to push up, or the fetal pillow, or Patwardhan's manual different for the back anterior and back posterior, or the reverse breech extraction. Thank you.